Well, a warm welcome to today's update, Thursday the 26th of May. I'm going to do a bit of a COVID review today, and things are going basically the way we expected. Cases and hospitalisations and deaths are going down in the UK. In the United States, this Omicron BA2 variant bounce that we've been anticipating for some time is happening, but it's nowhere near as big as I thought it was. So cases are up in the United States. Infections are clearly up, cases being a subset of infections. And hospitalisations are up a little bit in the States, but deaths are not. So this indicates there's a lot of community immunity being developed as we become more and more endemic. So that's roughly where we are, but I just want to give some numbers. Hopefully not too many COVID updates left now. Things are getting really remarkably much better in the UK and in the United States shortly, throughout Europe. Of course, North Korea and China, different story, but that's not for today's video. So here we have some new daily confirmed COVID-19 cases per million. Again, this is dependent on testing, so it's only a very crude approximation, but Australia, New Zealand, the United States, Ireland, United Kingdom, Denmark, South Africa, Canada. South Africa cases not going up as much as we had feared they might, because remember, of course, South Africa is going into their winter time now. Now, if we look at, this is the number of patients in hospital, and, well, United Kingdom, it's really come down quite dramatically, the number of patients in hospital. So that's all pretty good news. Canada is going down. Australia is levelish, fairly level, at a fairly low level, at a fairly low level. United States, as we mentioned, is starting to go up slightly. Denmark, where they abolished all restrictions a couple of months ago, maybe 3 months ago, going down really quite nicely as well. So the United States, a slight uptick. I'm not expecting it to be too dramatic though at all. And if we look at deaths finally on these graphics, these are cumulative deaths here. So interesting. New Zealand and Australia were able to keep the virus out until they had good levels of vaccination, which I think is the main reason that their levels of death are and severe illness and hospitalisations are low. Now, this says nothing about vaccine complications. We're just looking at, in this instance, we're just looking at deaths, and I think we can see evidence of efficacy here. Norway, Scandinavian country, fairly low levels of death. Now, I put Norway in because I wanted to compare it with Sweden today. Now, Sweden, without being too diplomatic about it, I think Sweden messed up the early stages of this pandemic. They panicked, and a lot of patients who could have survived didn't survive. The treatment strategies were palliative at far too early a stage in a patient's progress. So they've ended up with more deaths than Norway, which is their nearest counterpart. But going up, Canada, Denmark. So Denmark, again, very low levels of restrictions in Denmark for quite a long time, and yet the death rates are about the same as Canada, lower than Ireland, South Africa, Sweden. And here we are, the United Kingdom and the United States, ignominiously leading by quite a long way on the death front. Why is this? I think the main reason here has got to be co-morbidities. Obesity is a particular factor in the United States. Hypertension, diabetes are all particular factors in the States, as in the UK. And that difference between the US and the UK figures there does approximate to the difference in those different sorts of pre-existing conditions that we have in our countries. Now, I want to go on now and look at Omicron variants in the United States, and we've got some graphics to go with this as well. But if we look at just these figures first of all, BA2 in the United States, 39%. BA2 12.1 up to 58%, and this is a dramatic increase. So this one is going down, this one is going up, and I can show you that on the graphic here now. Here we have the BA2, which we could now call the old BA2, which replaced the BA1, which replaced the Delta, and now we see the BA2 12.1 becoming much more prevalent in the United States, displacing the BA2. So it really is quite an interesting story. Delta replaced by BA1, BA1 replaced by BA2, BA2 replaced by BA2 12.1 as they become more transmissible. These are intrinsically more transmissible. This virus is now so incredibly transmissible. This is why we've predicted for a long time that everyone's going to be exposed to it. Quite inevitable unless you become a complete hermit, which most people don't want to do. There's about 1% or so, 1.5% of less common Omicron derivatives, others virtually none, and Delta is now officially 0. So we see Delta has been completely outcompeted by the Omicron, and now it's a battle between the various types of Omicron variants. And at the moment the BA12.1 is leading. Now this indicates to me, we don't know this yet, but this indicates to me that the United States has been exposed to the BA4 and 5. Was it 5 and 6? 4 and 5, I think. Anyway, the new Omicron variants that are in South Africa. But even though the United States has been exposed to those, they're not outcompeting the BA2. So it looks like the BA2 12.1 is the most contagious variant, certainly in the American situation. Whether that changes the situation in South Africa or other European countries remains to be seen, but that is up-to-date information from the United States. Now, while we're in the States, let's have a bit of a general update. These shows the various proportions. Now, remember the dark orange is the new variant of the BA2 12.1, and it shows how it's taking over from the old BA2 in various parts of the country. So the rate of change is varying in different parts of the United States, but the trend is quite undeniable and pretty clear. This is the number of cases in the United States, so a slight uptick. Again, that depends on testing, but there is an uptick in infections, we know that, because of the new BA2 derivative variants. Moving on to hospitalizations in the States, as we said, there is a slight increase, but it is slight. Nowhere near as bad as I had been anticipating, so I'm very pleased that I was overly pessimistic on that. It just shows how much immunity from previous waves has been generated in the United States, and partly immunity generated by vaccination as well. But now we hope that natural immunity is taking over from the temporary vaccine immunity is the hope, and it's looking promising. It's looking promising at the moment, because I did anticipate this being way worse. Deaths in the United States. Now this is encouraging. They are down here. They are going down, or are they flat? You can interpret that yourself. I'd say they're flat at the moment to going down. And this is despite the increase in cases, infections and hospitalizations. So this is encouraging, because these new Omicron variants, while they're less pathogenic, are hitting a population which is has much higher levels of immunity. Now, moving on to the United Kingdom, this is the latest COVID symptom tracker data, and what it's basically showing is the Zoe data. These dots are quite close together now down here, so this is showing that we are levelling off, but going down very gradually is what seems to be happening. And I want to look at some Office for National Statistics data now that does show us some really quite interesting things about what's going on. Just a few highlights from that first of all before I look at the graphics. So the risk of reinfection is 8 times high with Omicron, in Omicron times now, compared with Delta times. So times 8 reinfections. People getting reinfected, much higher. People are definitely getting reinfected, but less pathogenic and generating lots of natural immunity. Deaths from COVID-19. COVID-19 is mentioned on fewer death certificates than flu and pneumonia death certificates, but more likely to be listed as the underlying cause of death. So there's fewer cases of COVID-19 compared to flu and pneumonia at the moment. But it is more likely to cause death. Now, the ONS have just produced a really fascinating new graphic on this, which I want to show you. Now. Really quite interesting. So let's just take a look at this new graphic that they've come up with. So this is a number of deaths of flu and pneumonia in England and Wales, 1901 to 2021. So what, 120 years of data here. Now, we notice, of course, this appalling increase in the Spanish flu. Now, notice that these are numbers of people. Of course, the proportion of the population there would be even higher if this had been a percentage, because the population is much higher now. But these here, these are the deaths due to COVID-19 in our 2 years here and here. So they are the COVID deaths there. And if we kind of compare those, we can do like a bit of a linear sort of comparison on this. And if we take a kind of an average of it there, we find that the last time the deaths were this high was back in, I think this is 1929. And even then it was only for a year, and averaging deaths from pneumonia and flu much lower. So the COVID deaths in numerical terms, much higher than deaths from due to flu and pneumonia, influenza and pneumonia. So if we look at previous years, we've got deaths from deaths from flu and pneumonia there, big increase up to the COVID time. Last time flu and pneumonia killed as many was 1929. So they come up with some absolutely brilliant graphics, the Office for National Statistics. Pity they don't do more antibody surveys, but I suppose you can't have everything. Now, here we have COVID-19 in 2020. Underlying cause of 73,766 deaths. In 2021, 67,258 deaths. And we have to go back, as we said, to 1929 for deaths from flu and pneumonia. 73,000 deaths then. So pretty well interesting, pretty well identical numbers. But of course, as a percentage of the population, it would have been higher back in 1929. So I thought that was really interesting historical context from the Office for National Statistics, showing that COVID definitely kills, or has killed in the last couple of years, more people than cold and flu. Now, what do we expect to happen here? Well, here we see these deaths due to COVID, and this is the data up to 2020 and 2021. We do expect this to carry on going down, and it will probably go down to about the same level as the influenza, as more and more people become immune. Of course, we can't know that yet because the time has simply not elapsed yet. Now, there's more interesting data from the ONS. Let's just have a look at some of that now. Patients are, this is actually the official government data. Patients admitted in England, so this is hospitalisations in England, down nicely, down 17% on the week. Now, this blip in cases where it's increased in the United States won't be long. It will soon be following the English or the UK trajectory of that. I feel we can be fairly confident. This one is deaths within 28 days. Now, okay, there's still 453 people have died, COVID being the main reason, but it is down quite really substantially on the week, which is good news. Again, good to see. This is the percentage of people testing positive in England. Well, clearly well down. But still, 2% of the population, still 1 in 50 people testing positive. This is still fairly high. I expect it to go down further as we go more into the endemic phase, but it's still relatively high. 2% is not an insignificant number. But despite this 2% of people being infected, as we saw, the hospitalisations are going down and the deaths are going down. So this is really quite good news. We don't mind infections. It's hospitalisations and deaths that we really don't want. This one is Scotland, percentage testing positive. Similar picture in Scotland. Well down. Again, slightly over the 2% mark, but basically the same as the English figure. Now, this is the amount of people that have tested positive in the antigen survey. This is the group of people that they've repeatedly tested to see how many have become positive. And 70% have tested positive during the course of the survey. Now, I suspect the real number is quite a bit higher than this, but this is the number the survey has picked up. With the antibody prevalence is about 99.1% at the moment in England, but then again, they're not differentiating between antibodies from natural infection and from vaccination, unfortunately. But this shows the number of people. So I think we can say at least 70% of the population of England have been exposed to the virus, enough to test positive. And I'm sure it's much higher than that. And we can see the effects of the immunity would indicate that it's higher than that as well. But that's the data we've got, so we have to go with that. Scotland, it's not as high. 51.5% have tested positive. But the Scottish survey started quite a bit later than the English survey. So the idea that there's a 20% difference in the people that have been tested positive or have been exposed to the virus in England and Scotland is ridiculous. They are pretty well the same. I believe both figures are above 70%, but we can't prove it because this is the data we have. So incomplete data there from Scotland, I think it's fair to say. Now, infection in various ages. This is 2 to school year 6, so that's basically 2 to 10-year-olds, 11-year-olds. Down quite nicely. It's the same in all age groups. I'm not going to show you all age groups, but the age group at more risk from hospitalisation, again, down quite substantially, but still at 2%, but yet we notice the hospitalisations and deaths are down, so this is encouraging. Even though there's still a fair amount of infection, hospitalisations and deaths are down as people, as the virus is meeting people whose immune system is prepared with adaptive specific immunity to combat this viral infection. This one is hospitalizations. Now, this is hospitalizations in total, down nicely. This is hospitalizations actually in intensive care, which have remained low, thankfully, especially during Omicron times. They have actually gone down. There was a slight blip with Omicron BA2 there, but not a lot. But hospitalizations going down really quite well, and never, it couldn't, well, we want this as soon as we can because there's such a backlog. There's about 6 million people waiting for treatment now on the NHS. It really is an appalling situation. People are suffering really significantly, and some must be dying, I'm afraid, because hospital treatments are so delayed. Not entirely because of the COVID pandemic, but a good chunk of that is because of the COVID pandemic. Now, number of critical care admissions where COVID-19 was the primary reason and the secondary reason. So what we have here, this is an interesting graphic. This light blue is people that were admitted to intensive care for COVID. So to be quite clear, the light blue patients were admitted because they had COVID. If they didn't have COVID, they wouldn't have been admitted to intensive care. These people here. Now, the dark blue is people that were admitted to intensive care who happened to have COVID. So these were admitted to intensive care in the light blue for COVID. The dark blue were admitted with COVID. And the interesting thing here, as we'll show on this graphic, which shows it in more detail, this is the percentage of critical care patients for whom COVID was reported as the primary reason for admission has gone down. So what we see is more people are being admitted to intensive care with COVID now than for COVID, as another indicator that we're entering into the endemic period. So now there's more people admitted to intensive care who happen to have COVID than because of complications of COVID, is what that graph is showing really quite nicely. And again, that is encouraging. Combination of the less pathogenic Omicron variants and the immunity that the virus is reaching as immunity becomes more widespread in the population. Now, that's for hospitalizations or intensive care, not hospitalizations in general. This is deaths involving COVID-19 decreasing. As we saw, this is the end. They're down even further now, as we saw a little bit further down, but that's the 13th of May, 795 deaths. But compared to what they have been, down remarkably large amounts. This is the proportion of deaths involving COVID-19 where death was the underlying cause. So what we have, England and Wales data here. Now, these solid lines are people who died from COVID. The others are the ones that died with COVID. So we can see that it's about, 65% there, roughly, of people that died with COVID on the death certificate. COVID was the underlying cause, and that other 45% or so died with COVID rather than from COVID. And this is I'm really hopeful that this trend is going to carry on going down, although at the moment it's not. And that's the figure we looked at there, that other one. Deaths due to COVID-19, deaths due to flu and pneumonia. Here, the data wasn't well processed there. But interesting, we go back to 1929 for such a high death rate. So we can see that the COVID has been way more pathogenic than the flu and the pneumonia induced by flu over the past decades, way back to 1929. Striking graph there with a H1N1 influenza pandemic there of 1918, 1919. Now these are people that died and the co-morbidities. Signs and symptoms of ill-defined conditions are now most common, then dementia, then chronic respiratory disease, then diabetes. Now dementia is defined as a progressive, irreversible impairment of intellectual function. It's not reversible, so we can't do much about that otherwise than optimise the other aspects of the individual's health. But we can do quite a bit to actively manage chronic lower respiratory disease, diabetes, diseases of the urinary system, ischemic heart disease, hypertensive disease. We have medicines and lifestyle implementations that are remarkably effective at lowering blood pressure. We need to optimise these conditions to minimise the chances of death from COVID, and people with no pre-existing conditions, about 14% dying from COVID there, and I think that's all we have. So there we have, that's it for today. So quite interesting really. The United Kingdom cases going down, infections going down, hospitalizations going down, deaths going down. The United States still in its Omicron variant, well, it's an increase. It is an uptick, but this is why. It's because they are this particular variant is sweeping through the country in the same way that the BA2 swept through the United Kingdom. But if you're watching in the States, just be reassured that people who are exposed to this virus will be developing natural immunity to that virus. So optimistic about the progress into endemicity. And I think that's all. So thank you for watching.